During the first 7 months of 2018, there have been 28,971 visits to the Weisberg Center for more than 50,000 annual visits, said Bepler, who became Karmanos CEO in 2010. Most of the 19 physicians on staff at the center split their time at the main hospital located on the campus of Detroit Medical Center. The Weisberg Cancer Treatment Center also has 15 nurses, nurse practitioners, dietary and genetic counselors and social workers as well as other support staff. We technically don't turn away people, but we are at capacity and can't place more physicians or providers there, and also can't see more patients, Bepler said. McLaren promised to spend at least $80 million on overall Karmanos improvements, including expansion of the Farmington Hills Center, after Karmanos joined McLaren in 2013. McLaren has spent more than $49 million to expand the Cancer Center brand into Greater Michigan at its other hospital and outpatient facilities. Now, the Cancer Institute has 14 sites in Michigan. Karmanos hired architectural firm Gifari Associates and construction contractor Ron Shelley Inc., and McLaren approved the building plan for the Farmington Hills Center 2 weeks ago, Bepler said. Plans call for the Weisberg Center to quadruple from 17,700 square feet to 69,100 square feet, a 290% increase. The first phase of the project will focus on expanding imaging bays and space for research in the radiation oncology area and on adding procedure rooms and an interventional radiology suite. By April 2019, the second phase will renovate the infusion, laboratory and pharmacy areas, clinic care space and areas where support services and survivorship programming are held. Once complete, Karmanos plans to hire 10 additional doctors, 15 nurses and other employees. It also will add services. Now, Bepler said, people come for a clinic visit and get basic testing done and chemotherapy, but the center can't provide blood transfusions, which requires patients to go to the Detroit Center or a competitor, which isn't ideal. That will change, he said. We will have a full-service oncology program. The only thing missing will be inpatient care. The Weisberg Center will place catheters in patients, draw fluids, do biopsies and blood transfusions and provide complete imaging, including MRI, PET, CT and interventional radiology. However, bone marrow patients will continue to visit Karmanos in Detroit. Officials expect the renovated and expanded Weisberg Cancer Treatment Center to be complete in 2021. And Bepler expects the number of visits slowly to increase by about 70%. Expanding the hospital required Karmanos to acquire the adjacent the DMC-owned Rose Radiology Center. Karmanos owned the left side and DMC owned the right side, until DMC decommissioned Rose Radiology in 2012, Bepler said. DMC initially didn't want to sell the building but agreed in 2016 to sell the facility to Karmanos for an undisclosed price. We considered a new ambulatory site in Novi in April 2015, Bepler said. However, shortly after the board approved the move to the Meadowbrook Medical Center, the Centers for Medicare and Medicaid Services announced it planned to reduce the amount of reimbursement hospitals could charge at outpatient facilities. We scrapped the Novi Center because the reimbursement was much less than we had planned, Bepler said.